In Fox 5 Health News, the FDA just approved a fast-acting treatment for migraines. Researchers say patients can get pain relief in just 15 minutes.
All right, joining us now, Dr. Serge Sugger, Chief of Infectious Diseases at Holy Name. When I was younger, I used to get migraines, and they are just nightmarish. So tell us how this works, and the great thing about it is how quickly it works.
Yeah, so you hit the nail on the head. Thanks for having me, guys. This is extremely important breakthrough in the treatment of migraines. And just to put in context, about 39 million Americans are afflicted with this disease process. You can imagine any new advances would be very impactful. This is a new nasal spray. It's manufactured by Pfizer. And as you already mentioned, you can see effects in up to 15 minutes. So why is this advantage? And how is this a advantage over what's already available? So one of the hallmarks of migraine headaches, besides the headache, is nausea, photophobia. So you think about people have lights that really affects them. They have to lie down, and nausea and vomiting. So you can imagine oftentimes they're unable to really take medication, so taking a nasal spray would be a significant advantage. Now, truth be told, there are other nasal sprays that are out there, but the mechanism of action, that is how this drug works, is what's very exciting. It inhibits a entity called calcitonin G-related protein, and that causes the brain releases this, and that can cause inflammation. So if you block this chemical, this protein, it can relieve the effects of migraine headaches. Now, this, unlike other drugs, does not affect people, doesn't affect the blood pressure. And so therefore, if people have heart attacks or risk factors of heart attacks or cardiovascular disease or high blood pressure, they oftentimes can take existing migraine medications. The way this medication works, it does not affect people's blood pressures. And so that way, those that have those risk factors can still take this medication. So again, very fastly effective, bypasses the need to take pills. So very, very exciting news indeed.
Yeah, it sounds like it is definitely a breakthrough. We want to talk about a new study now that's finding men with early stage prostate cancer don't have to rush to radiation or surgery. Instead, they can opt for what's called active surveillance or watchful waiting. So doctor, tell us about what this study found.
Sure. And so again, to put this in perspective, prostate cancer is the second most common cancer in men after skin cancer. So oftentimes when people get a diagnosis, the decision is what to do. Do you start treatment right away or do you wait? Because prostate cancer in most instances, and that's the key here, in most instances is very slow growing. This is a very well-designed study coming out of the UK, going over almost 2 decades of follow-up, was recently published in New England Journal of Medicine. And basically the summary is they looked at 3 different groups. People who had surgery right away, we call prostatectomy, they had surgery to remove the prostate, versus radiation and hormone treatment, versus this watchful watching, or what we call active surveillance. And what they found is that if people that waited did not have increased risk of death versus the other 2 groups. And that's impactful and important for the following reasons. While the treatments for prostate cancer are very effective, they are not without their side effects. Think with surgery, especially, and radiation, you can have effects on sexual health, so erectile dysfunction. You can have urinary issues, you can have bowel incontinence. So they are not benign issues. What the study is showing is that once the diagnosis is made, again, in a disease process that 1 in 9 men over their lifetime may come with, because it's so slow growing, they can take time, talk to their healthcare provider, and really decide, do they need to go with treatment right away, or is there watchful waiting, or what we call active surveillance. And active surveillance, a lot of our viewers may know, have heard of the PSA test, or prostate specific antigen. We also have prosthetic MRIs. We have genetic testing. So we have a lot of tools that are disposable to determine who can watchfully and wait and take their time before undergoing specific treatments, and who of those need prompt aggressive treatment. And those would be the 15% who have what we call high-risk cancers. Most of the prostate cancers are low and moderate risk. Those are the ones we're talking about can have watchful waiting. The high-risk cancers, well, they require a more aggressive course of treatment.
Right, yeah, surgery isn't always the best course of action. All right, Dr. Sugger, we appreciate it. Thank you very much.
Thanks for having me.